I'm Mike Vories with Carolina Hair Surgery, and I wanted to take a few minutes and present a case that we saw a few years ago of a 31-year-old male who 2 years prior to us seeing him underwent an abdominal procedure in the hospital. And while he was in the hospital, he acquired a MRSA infection that really ravaged his frontal and mid scalp. There had been no changes over the past 2 years, no new hair growth, but no additional hair damage up to that point. When we see cases like this is what we call a scarring hair loss. And the problem that we have with scarring hair losses is the scar can have a variable amount of blood supply. And since blood is needed for hair to grow, we did not want to go in and do a full-on procedure with him with the prospect that the procedure would fail because of the lack of blood supply. So when we look at these cases, we like to do a test case. A test case is just a very small hair transplant of about 100 grafts into a defined area. Then we sit back and wait. The patient underwent this test case where you can see a block we drew onto his mid-scalp, and we filled that up with 100 grafts exactly. And then 6 months later, he came back for follow-up. And here is the results of his follow-up from the test case. First of all, you can see the small patch of hair that is growing in the block that we demarcated in the original procedure. And then we were able to clip the hair so we could actually get a count of how many of the 100 grafts grew in the scar tissue. And here's a picture of me just putting a number to each one of the grafts. And you can see that out of the 100 grafts that we transplanted, we had 99 grafts grow into the scar tissue, which we consider anything over 75% a success. This was far better than that, and we felt much more comfortable at sitting him down and doing a 2,500 graft case where we fill in the area that was attacked by the MRSA infection. So we did the procedure. Here's an immediate post-op picture of the grafts in place. And then he came back both at the 6-month and the 1 year mark. And 1 year is usually the end point for when we see total hair growth. And these are the photos of him coming in at the 1 year mark. Again, we have the pre-op photos and the post-op photos at 1 year. And you can see this made a dramatic change in this patient's self-esteem, his ability to hold a job that did not require wearing a hat, that he was able to be seen out in public. And so this is an example of the power of hair transplant surgery and how it can affect someone who went through a really scary situation a few years ago.